a short broad pedicle here that is connecting the medial surface of the lung, this is the medial surface of the lung, to the mediastinum. This is the mediastinum, right? It's formed by structures which either enter or come out of the lung at the hilum, that is Latin for depression. The roots of the lung lie opposite the bodies of the fifth, sixth, and the seventh thoracic vertebrae. The root is made up of the following structures: the principal bronchus on the left side, the eparterial and the hyparterial bronchus on the right side in the posterior part. One pulmonary artery in the middle part, two pulmonary veins, where two pulmonary veins, superior and inferior in the anterior part. It is VAB, vein, artery, bronchus, from anterior to posterior. The bronchial arteries, one on the right side and two on the left side, also contains the bronchial veins, the anterior and posterior pulmonary plexus of nerves, lymphatics of the lungs, the bronchopulmonary lymph nodes, and the alveolar tissue. Arrangement of structures in the root of the right side from posterior to anterior side. Okay. Now, eparterial, hyparterial bronchus with the bronchial vessels and the posterior pulmonary plexus along their posterior wall, pulmonary artery in the midplane between the two bronchi, the superior and the inferior pulmonary veins in the anterior part, anterior pulmonary plexus, lymph nodes and lymph vessels in the anterior and the inferior parts. Arrangement of structures in the root on the left side from posterior to anterior. A single bronchus, bronchial vessels in posterior pulmonary plexus along its posterior wall, pulmonary artery in the middle area placed above the bronchus, the superior and inferior pulmonary veins in the anterior part, along with the anterior pulmonary plexus, the lymph node, and lymph vessels in the anterior and the inferior part. Structures related to the mediastinal surface of the right lung. This is the right atrium and the right auricle on the right side, a small part of the right ventricle. This is the superior vena cava, you can see the impressions, the lower part of the right brachiocephalic vein, and this is your A's vein over here. Also we have the esophagus, so the azygous vein, in front lies the esophagus, so this is the groove for the esophagus, the inferior vena cava, the trachea, right vagus nerve, right phrenic nerve, and the left recurrent laryngeal nerve. On to the left side, we have the impressions of the left ventricle, you can see over here, the left auricle, infundibulum and adjoining part of the right ventricle, the pulmonary trunk, this is the arch of aorta, the descending thoracic aorta, and the brachiocephalic vein. Left subclavian artery, the thoracic duct, esophagus, left brachiocephalic vein, left vagus, left phrenic nerve, left vagus nerve, and left recurrent laryngeal nerve. Here. Okay. So just to simplify, here. Okay. Just see the impressions. Right? Relations of the root here. Anteriorly, common on both the sides, we have the phrenic nerve running anteriorly, the pericardiophrenec vessels, and the anterior pulmonary plexus. On the right side, we have the superior vena cava and a part of the right atrium. Posteriorly, common on both sides is the vagus nerve. See the vagus nerve over here, lying posterior to the root of the lung. The posterior pulmonary plexus. On the left side, we have the descending thoracic aorta. Superiorly, the terminal part of the azygous vein on the right side and the arch of aorta on the left side. And inferiorly again we have the pulmonary ligament. Now, differences between the right and the left lung. It is shorter, broader. This is longer and narrower, larger and heavier, smaller and lighter. The left one. Anterior border is straight. Here the anterior border is interrupted by the cardiac notch. The cardiac impression is very shallow or absent. This has a prominent deep cardiac impression on the left. There is absence of lingular on the right side, whereas presence of it in the left part. And mostly it has two fissures and three lobes, the right lung, and the left lung generally has one fissure